let's talk about behavioural techniques for cognitive therapy for depression, the model developed by Beck. So we know that people with depression have low levels of positive reinforcement, and this is why behaviour change is such an important feature of cognitive therapy. So people with depression, we know that they use behaviours to cope with negative feelings, and quite often it's used to, I suppose, cope. So people with depression will often strive to feel better in the short run, and we know that the short-term reward mechanisms are much stronger than the longer-term ones, which is why that short-term relief is actually so much more potent and easily to get sucked into, I suppose, compared to considering the long-term benefits of things. But of course, those short-term gains for a patient are likely to be detrimental in that long run. So I want to focus as well on the process of negative reinforcement. So this could include withdrawing socially. So you remove that stimulus that is considered really difficult. So when I talk about negative reinforcement, I do feel like I need to explain a disclaimer. Negative reinforcement is not that there's a negative event, but you take something away and the reinforcement is that the behaviour is more likely to happen. So when you have someone withdrawing socially, you're removing that aversive kind of or perceived aversive stimulus, the social element, and by doing that, you're getting that reinforcing effect, you're feeling better, which will in turn make you more likely to withdraw the next time. Now, patients with depression will also cease to engage in a variety of activities, not just socialising, and they will often describe shutting down. Many patients with depression in cognitive therapy will say that they believe that they're no longer capable of that previous level of functioning. They believe that they're not able to enjoy activities at all. And I would really encourage you to work on vicious cycles with patients to understand that link between them. You may also notice that patients find it a little bit more difficult to reason and plan and action certain activities, and they may have struggled with this in the past when they are feeling depressed. So it's really good for you to help them just stop and think about these processes in more detail. So another thing I want to say just in this summary section is that it really is a means to an end. Remember, this is not behavioural activation for depression. This is a cognitive therapy. So it's trying to achieve that cognitive change in someone. So the activity schedule is really about identifying thoughts, identifying negative automatic thoughts, identifying opportunity to change those or question those as well. So when I set an activity schedule with a patient, they often say, I just don't do anything. I really just don't do anything nowadays. And actually an activity schedule in itself can be really quite helpful for a patient to see that they are doing quite a lot of tasks that they didn't quite realise. So we're going to be talking about grading tasks. I'm going to be talking about mastery and pleasure, and excuse me, I'd like to talk a little bit about cognitive rehearsal as well. That's imagining each step in detail and sequence. So let's think about scheduling activities. We want to make sure a patient isn't avoiding and giving up when they're hitting difficulty. They may have automatic thoughts of, there is no point, I will fail. So activity scheduling is all about that collaborative planning of hourly tasks. And It's really important that those goals are really meaningful for the patient. So each task that you set together is an experiment. No one accomplishes everything, that's okay, but it's how much, it's what you will do rather than how much you do, and everything needs to be praised. You need to praise for any attempt at doing things. So there's a number of ways that you can practice activity scheduling. So one is just simply planning the next day. So you could maybe test a certain idea that has come from your therapy session. So it might be that, I can't, or I don't do anything, or nothing makes a difference. I'm powerless to change. And so it's saying to a patient, let's test this out, not just whether this is the case, but actually what effect on your mood would there be if you did some more activity, some more of this that you don't feel that you do at the moment. And it's testing out the impact that it has on their mood. And then of course you can come back and review. Another focus for activity scheduling that Beck outlines is that mastery and pleasure kind of rating of activities. So there may be particular problems that they are avoiding solving, and actually it's about really developing that mastery over overcoming those problems. It might be that they are engaging in pleasurable tasks, but actually those tasks are full of negative appraisals about themselves or other people or the future. So it's about really, really homing in on those and understanding them. It may be in the same vein in tasks which are supposed to be pleasurable, where their focus is about why they don't enjoy it. So what are they focusing on? And of course, we know that patients with depression have that selective inattention to pleasure. So it's about really homing in on that full focus, that full attention. So to do this kind of work with the mastery and pleasure, you want to ask your patient to rate their mastery from 1 to 5 and their pleasure from 1 to 5. Again, for each hour of every day, specifically or especially when it's concerning an activity. Okay, and so once you've done the exploration of the activity scheduling, it really comes down to the task assignment. So you want to grade this, and for every task that you assign, it's really good to define the problem, exactly what is the issue here, and you want to define that as well as possible, fully operationalized, what have you. So and then it's about the project steps, simple to complex. How can I break this down to the most simplest sort of tasks? And when you set these tasks, it's about acknowledging each step that's being completed and really reinforcing that, giving that praise, and really highlighting where that patient has developed a new skill, a resilience, that adaptability that is going to help them overcome depression. Throughout the activity scheduling process, there will be negative appraisals. So it's about you identifying these and challenging them along the way. And you want to emphasise their skills, their efforts, but also draw their attention to anything they're avoiding as well. So the final thing I wanted to talk to you about is cognitive rehearsal. So cognitive rehearsal, quite often we are on autopilot, aren't we? You will run upstairs and then forget why you got there, or some people who engage in obsessive rumination, so they think over and over again about certain aspects, certain problems, without actually coming to a solution or they worry excessively, as you'd probably find in generalized anxiety disorder. You might find that their concentration is very much on their thoughts, and they may even feel like they're losing their mind. They don't have that control over their thoughts. So I suppose it's about getting out of that autopilot for someone with depression, that they're thinking negatively, and just really kind of doing things mindfully, intentionally. And one way you can operationalize this in your sessions when it comes to setting these activities is to ask them to visualize each step of their activity scheduling process, so of their task, of their goal. And this will help them overcome any roadblocks. So in real terms, it's stopping and thinking about exactly how will I tidy that room that I've just left and just stuck everything in over the years. So it might be one box at a time, that's your step, and it might be really visualizing how do I do that. It might be taking a box, pulling it out of the room, might be emptying it onto the carpet and selecting 5 things that you're going to sort out. So it's really breaking it down, and you can do that with getting to the gym or doing the shopping or doing your uni work, for example. I did say that was the final thing, but I have just thought about the other element that is really important to consider, which you probably will need when you're doing cognitive therapy for depression, and that's kind of assertiveness training and role playing. So this might be role playing how to order something in a shop or a restaurant, or how to send something back in a restaurant that's not been cooked exactly how you like it. It might be role playing how to have a conversation with your flatmate about something that's really been bothering you for some time. So assertiveness training and role playing is probably going to be important at some point for a person who's been depressed, especially someone who's been depressed for a long time. And when doing this kind of work around assertiveness, it's really important to kind of consider the person's reaction to the change. So the way the flatmate might react, or perhaps how partner will react when you say, actually, no, I'm not happy with this, or you develop those assertiveness skills. Okay, so there's some really good behavioural change techniques in cognitive therapy. I hope you've got a lot from this part of the video. Thank you.